I am joined by my good friend, Dr. Richard Scott. Hello, sir.
Good evening, Andy.
Now, I'm going to jump straight into this because a while ago I asked you about methadone. Not for me personally, just to clarify, but because I've had quite a few interviews where the topic of methadone has come up. And it's one of those things that, well, I think I know what it is and I think I know what it's supposed to do. And then when I reflected, I realised I actually don't know what it's for. I don't know what it's actually supposed to do, how it's supposed to work, when would you do that? So I thought, well, who can I ask? Well, I do know the good sir, Mr. Richard Scott, previously GP for quite a while. So I asked you to have a bit of research because I think it is one of those. I know we've talked about various things. I mean, we talk about drugs of varying kinds and addictions and all that sort of stuff. But methadone is quite specific, as you shared a little while ago. So I just thought it'd be interesting, to be honest, to find out more about it. So I don't need dosages because I'm not a doctor. But when would it be applied? When would it be bad? What does it do? What is it? And when would anybody need to have it?
Well, thank you. And I'm grateful. It's good to have suggestions because otherwise I've got to think up what or find something in the paper. So when you suggested methadone, and that's really good. I think you'd said you'd had chats with ex-prisoners. It's something like 5 conversations in quick succession, with like God was really prompting to say, let's look into methadone. Absolutely, I'm going to answer. What is it? Why does it remain so important? A bit more information. So it's just interesting what you said. I don't know much about methadone because it's exactly the same question I asked myself when I started in general practice in Margate in 1998, because we'd had no training in medical school on drug addiction, none whatsoever. And I might say in my year as a trainee, I'd had no training on drug addiction. And then suddenly there I am in Margate having prayed, and the Lord answered this prayer. I prayed, Lord, I want to work in a poor area on the coast. And within 3 weeks, he'd provided this job in Margate. Heather and I have job shared. And I was thinking, well, that's good, poor area on the coast, but there's a lot of coast and there's a lot of poor areas. Why Margate? And then the answer came literally day one. Drug addicts poured in to my clinic door. And I was having to think, my goodness, wow, okay, what am I going to do for them? So, and it rapidly became clear that there were 2 aspects. One was the medical aspect, which often involved methadone. The second was these guys need more than this. And this is a separate conversation. I want to get them on alpha and properly change their lives. So that was sort of really the focus of 10 or 15 years of work. But back to methadone, the reason I was so sort of challenged by it was you're facing with people and they say, well, I need some methadone. In other words, can you restart it? Or I've literally just come off heroin. I don't want the shakes. I don't want all the problems that you get coming off. So can I have some methadone? So you're starting something. Other people, the dose needs titrating. If I'm doing well, can we begin to reduce the dose? You then work with drug agencies who say, oh yeah, that's great. I'm glad you got this person on, but make sure you reduce it over the next few months. Then someone has a relapse. They either go to prison or they take heroin on top, which we'll come to in a moment. Then you have to up the dose. So it's quite a business. Plus, it was unbelievably irritating at the beginning because we had to do everything twice on the computer and handwritten prescriptions because it's a controlled drug. So that was my life for ages, having to do both. But it was a real challenge because I really wanted to help these guys, and we saw some drug addicts come to Christ. So it was very good on both aspects, really. But a little bit more about methadone, because this is obviously a talk for our listeners and yourself, not for medical students or young doctors. So what do we need to know?
It's probably not that advanced for that sort of training.
Well, I'll give you enough really because it is important. It's been going many years. So it is a long-acting, and that's the key point, a long-acting synthetic, so it's made by man, opioid. Opioids and opiates are the drugs that we know about, serious painkillers. We can think of the ones that are illicit, heroin, for example, morphine, which can be illicit or prescribed by doctors, oxycodone, massive problem with addiction in America with oxycodone. So many thousands of people dying from overdoses in America every year. Oxycodone's a massive drug and a massive problem. But the reason all these things, including methadone, are important is because they are such powerful painkillers. Now, therefore, methadone, you might imagine, could be used to treat pain. And indeed it can. But it isn't, because we have other painkillers for that. It's used in opioid addiction, how to get people off other more dangerous opioids. And the way it works is all of these things, heroin, morphine, morphine, oxycodone, methadone, bind to opioid receptors in the brain. So if you take an opioid, whether it's by mouth or injection, or then it goes straight to the brain through the blood, binds the receptors, and you get this euphoric hit, which is why people take it. And methadone, of course, being an opioid, binds to the same receptors, but without giving you the same hit, because it acts very slowly over 24 to 36 hours. It's not an instant effect. Now, that's really important. Therefore, it doesn't do the same damage that, say, for example, heroin does. How do you take it? Well, it's a pink liquid, and you take it in controlled fashions or amounts, usually from drug clinics, although GPs, if they have some interest and ability, can also prescribe it. And it stops the cravings for heroin and all the withdrawal symptoms when you're coming off it. So say someone comes off heroin and they're desperate, they're coming into clinic, you'll see the anxiety, shaking, pacing around the room, muscle cramps, diarrhea. And at that point we know they're in trouble. We need to get them on some methadone without giving them the hit and without the dangerous uncontrolled use that heroin gives. So for example, really big issue, someone goes to prison and they lose their tolerance to heroin, because that's a big issue. And when they come out, they're sort of effectively, to use a term, a heroin virgin. And if they suddenly go back on huge doses of heroin like they were on before, they'll drop dead from respiratory depression.
Wow.
What they need is a controlled dose of something like methadone to stabilize them so they don't have the symptoms, and it's also not so dangerous. So how can you use heroin? How can you use methadone? That's a slip of the tongue. How can you use methadone? How do we use it as doctors? Well, in two ways. It's either a maintenance drug, keeping the person off heroin but giving them the same dose of methadone. These are people who failed for years to get off heroin. To be honest, we think they'll never, ever get off it. And drug clinics will say, look, just keep them on the same dose of methadone. It's not perfect, but it's an awful lot safer as a safe substitute than being on the heroin. Or, and this is much more common, as a detox, where we give them a methadone dose and then slowly reduce it over time to wean people off opiates completely. That's the most common and the most satisfying thing to do. And that way you don't just have one opiate, if you like, or opioid replacing another, aiming to get off the drugs completely. Now, you might ask, because you're a smart chap, Andy, it's Sometimes. An opioid. And if you're simply replacing one opioid with another, is it completely safe? And the answer is no, it isn't. These are all inherently dangerous drugs, so it's not completely safe. And if you take it with other depressant type drugs, alcohol, benzodiazepines like diazepam, it can lead to a fatal overdose. And it's also habit forming. It's got side effects: nausea, vomiting, constipation, drowsiness, sweating, dry mouth, and I might say, this is really interesting, awful teeth. If you've seen drug addicts who've been on either heroin or particularly methadone for many years, they've almost always lost all their teeth by about the age of 40. Because A, methadone is very sweet. B, when you're on methadone or other things like heroin, it damages and dries up the saliva. It damages the salivary glands, dries up the saliva. Saliva protects our gums from caries and dental issues. So if you're on this stuff, then you get dental problems. Plus, they get sugar cravings. So it's a triple hit of sugar in the methadone, damaging the salivary glands and sugar cravings. And they have awful teeth. And you'll see people coming in with much younger than yourself with what I call old man's gums. You know, people who've lost their teeth. My mum, if you put in false teeth, you have bone resorption from your mandibles, and you get these sort of what I call old man's gums. So it's, it has its side effects like any drug. And it's risky if you take it with other drugs, particularly alcohol and benzodiazepines. Now, you do need to titrate it. Watch the dose. Highly dangerous if you give too much methadone, even though it's a slow acting thing. Because it's slow acting, if you keep taking it, particularly if people take it too rapidly, then it can just build up, and that can cause fatal respiratory depression, a bit like a heroin overdose. But it's much, much less common. Over time, people develop tolerance to it, so you need to increase the dose. They also get dependent on it. And of course, you want to keep it away from kids and pets. Very, very dangerous in that situation. Here's the thing that we used to find, though. People can misbehave on methadone. You can take heroin on top. It's not a blocker. And we'll come to that in a second. So people think, I've had some methadone, that's okay. And then they're offered heroin at a party or from their mate down the road. And that just gives you an extra effect, which is quite quite pleasant because they get free methadone from a clinic, then they get maybe some heroin on the streets. Methadone is staying in the body a long time. You're adding in another one. The top-up effect can be very dangerous because they're going well above what they're tolerant to. So that's dangerous. It's not a blocker, which is where, and Heather said to me before I did this talk, make sure you talk about Subutex. So over the last 15 years, we used to prescribe plenty of Subutex rather than methadone. Why? Well, it's buprenorphine. It's a type of opioid, but it's not what we call a full opioid agonist. It doesn't completely act as an opioid. It's only a partial one. Why does that matter? Well, it binds to the receptors, so it gives you the effect, if you like, of an opioid slowly, but with a ceiling effect, which means that if they go up on the dose, the effect comes down. So increasing the opioid effect tapers the effect tapers off even if you increase the dose. So it's much less dangerous. There's less abuse with it, and it's much less dangerous in overdose. It's more flexible. You can take it at home. It's just a tablet. We used to prescribe it so much in clinic. And you can even add in naloxone, which you may have heard of a drug called naloxone when people have a heroin overdose and they're dying on the street with pinpoint pupils. Trained ambulance men will give them a shot of naloxone, and suddenly the heroin effect is antagonized. Well, you can add in naloxone to Subutex and make Suboxone, which is a combined drug. So it's all very clever. Again, you've got to watch the dose. So I think the thing about methadone is it's still very useful. It's a very useful, slower acting drug, which helps to get people either off heroin completely or as a maintenance dose, because it's a safer, much more slowly acting opioid. It's a good drug. It's not perfect. It'd be wonderful to get everybody off all of these opioids. I get that. And that's where prayer can come in. We know that Jackie Pullinger doesn't bother using any of this stuff. She simply prays for the Holy Spirit to come into people. And guess what? They're completely healed. That's marvellous. In medical circles, we pray for people as well. But we have drugs to use as well. And there we go. Methadone.
You mentioned blockers. What are they? I mean, I think there's something that prevents it from working, but that's probably not true.
So yes, so a blocker is something that if you give a drug which is a blocker, then heroin has no effect at all. Drugs like heroin have no effect at all, and it's not a blocker. It's not an antagonist. It's an agonist which works very, very slowly. So it's not a blocker. It has the same sort of effect as heroin, just much more slowly, and in a controlled environment where you're controlling the dose. So it's not a blocker. And in that sense, it's not you might say not a perfect drug, but there we are.
So wouldn't a blocker be the thing that fixes heroin because they wouldn't want to take it because it won't work? Or am I completely missing this?
Yes, in some ways, as long as they get some effect from it, because you're still giving people a slower effect from the methadone, so that people don't have the craving for heroin. So if you have just a drug that simply blocks but without any effect, people are thinking, well, I don't like that. I'm missing my heroin hit. So it's a sort of halfway house with methadone. Subutex I preferred because we could give it as a tablet. They don't have to go to drug clinics to get a liquid and often have people like pharmacists watch them take it to make sure they don't squirrel it away or pour it away and claim they've had it. And there's all sorts of games that are played in the drug scene. Subutex is a tablet. And it's the only danger with that is it can be sold on the streets. So people can still misbehave, or even, and this is nasty, inject it as a tablet. They'll take off the coating and inject the inside. That's not a good idea, but again, that can happen sometimes. So it was always a real joy when we get people completely off all of these drugs. It didn't happen as often as I would have liked, but it was a real joy when it took place.
Now, heroin, we've talked about cocaine before, and that was developed, I think I'm right, that was developed by scientists for certain purposes. Is heroin something that was designed by scientists, medical world, or is that just a drug that's been brought in that is horrendously addictive?
Discovered in poppies. That's where it was discovered that people got highs from poppies, which is why in Afghanistan and Pakistan and places where poppies are grown, now, sadly, farmers are not growing their normal staple crops because poppies bring in so much money. So if you like, it's a naturally occurring opioid, which can then again be taken and refined a bit and on the black market sold because it's so incredibly lucrative and dangerous. Poppies, sadly, beautiful though they are to look at, have this unwanted extra sides, an extra arm to their bow. I'm using the wrong analogy, but you know what I mean. Arrow to their quiver.
But yeah, not a good one. Now, diazepam, I know I had some long time ago. I've shared it before. It's not particularly exciting. I took some because I had a bad back, and the doctor said you need to sleep. If I give you this, you will actually be forced to relax and therefore get some sleep. And we've got to. At that point, I had a bad back, really, really severe, and it would break the cycle of sleep and exhaustion and pain, which it did. I took half a tablet and never wanted to take any ever again. Did not like it.
Because it's not just a brain relaxant, it's a muscle relaxant.
Yeah.
So genuinely, if someone's back goes into spasm, diazepam, along with other painkillers, diazepam is your man. Low dose, to even 2 milligrams, not the usual 5 or 10 that people take. Just 2 milligrams, say a couple of times a day, will really make a difference to people. Very good drug.
I'd slept. I had horrible dreams and thought I don't want to take that. But in fairness, my GP was bang on. It actually did help me to sleep. It broke the cycle of pain and tiredness and frustration and all that. It helped me to sleep because it was a muscle relaxant. How is it that diazepam, I'm not necessarily after the really, really sciencey stuff, but how does diazepam act with heroin or methadone so badly that it can kill people?
These are all alcohol and diazepam are what we call depressants. They depress functions in the brain. And when you have depressants with other depressants like heroin, then overall it's a combined effect. So it increases the effect of the major depressant, which in this case is heroin. So even with methadone, the same. It can be. I mean, what I liked, but one of the things we did over the years, and it's not always popular with other doctors, but it was a good thing. Was that there are many people who don't want any opiates at all, but they need something to deal with the awful anxiety drug addicts have, and I would give diazepam because it's much safer than heroin. Again, it's not perfect, but as long as people played the game and didn't top it up with other things, and that was. That's a big if, but if they played the game and just stuck to the diazepam, leaving off all the other stuff that they could take, then again, it's a very cheap drug. It's easy to prescribe. Again, you can taper off the dose, but it is a depressant, so you have to be careful that if they are taking other stuff, well, it's dangerous.
You see, now that's where I was getting confused because I would have thought heroin was the opposite of a depressant because it has the euphoric thing, which I would have thought was an antidepressant.
Spiritual depressant. It's so you can get. I agree. That's why people take it, because they get this big hit. After which, of course, you can come down again. But it's a respiratory depressant, so that's why someone who's taken a massive overdose literally stops breathing, and that's what kills them.
I think this is why people. I asked Quisler that. This is why people are so glad that I was not the GP.
You ask great questions, and well, I wish I could answer them all.
No, I just thought it was just interesting because I completely misunderstood what it did. Now, we had this conversation with smoking and vaping, and we were very clear that vaping is not a safer alternative. It's just a less bad alternative. I would therefore surmise that methadone is not a better alternative. It is just a less bad alternative to heroin. Is that about right?
I think that's absolutely right. People have it's synthetic. It's been designed to work much more slowly and to last much longer, to get rid of the cravings and all the bad stuff that they would feel coming off heroin, but without giving the euphoric hit. Because if you have the euphoric hit, which you'll only get if it works really quickly, then in one sense, well, how are you helping this person? So you're training them away from this sort of constant desire for a euphoric hit, whilst managing the side effects that they would get coming off the withdrawal symptoms they would get coming off the drug. And hopefully, if people move in the right direction, they come off it all, and then are delighted because they no longer have to go to a drug clinic and get their methadone, which is a pain for them. Yeah.
Now, the teeth was the other one that completely threw me. I had no concept of that bit. I don't know why. It just never, ever entered my head. But really bad teeth. I mean, that's... Again, you're taking something that's really bad for you. You expect to have bad things. But, of course, if we're going to generate something that's synthetic like methadone, it's going to have some pretty nasty side effects. And that's quite a bad one.
It is a bad one. I mean, you get the same from any of the other opiates will do the same thing. It's just that with methadone, it's particularly nasty because we're giving it to people. And it's not something I knew about until I kept seeing. And I remember saying to one of the drug addicts, why are your teeth so terrible? Black, pointed, just awful. constantly coming in with gum abscesses, which we then treat with antibiotics. Go to your dentist, and the dentist would take a few more out, and then they'd have sort of one or two left. And they said to me, what they said was, it's just very sugary, methadone. Okay, what I then learned by looking it up is actually it's not just that. It's the reduction in saliva that it causes by damaging salivary glands, and it causes this craving for sugar. So it really is a triple hit in terms of sugar, which will then cause this. Plus, if you add in a poor diet, smoking, which isn't good for your gums as well. It is multifactorial, but really it's a bad one, but it's not bad enough to stop them taking it, because the desire, the hit is so strong.
Which is why heroin and cocaine, they are such horrendous drugs, because it isn't something you can just have a play with. It will grab you and not let go.
Yeah, and the same with the ketamine that we mentioned a few weeks ago. Fortunately, not in everybody, but in a significant number of people.
Only one other thing which really hit me was you're talking about oxycodone and the US in particular. People are dying. How do we get to a situation where people are just? I mean, I know there's a black market, but with the numbers you're talking about, I'm thinking that's got to be more than the black market, surely.
Prescribed by doctors under a lot of pressure, I might say, from one of the particular drug companies, which has been it's been sued for hundreds of millions of dollars by patients. There's been a class action against this. I can't remember the name of the company now. There's been a class action because doctors were encouraged to prescribe oxycodone, prescribed it, then people got hold of it on the black market. People got addicted to it, so that's why they got hold of the black market. They wouldn't come off it, and suddenly an oxycodone epidemic took place, or has taken place, in America. And now they've got this awful situation trying to get people off it, because it is a dangerous drug. And it's it was pushed heavily by drug companies, sadly to the general public's detriment.
See, I was so terrified of addiction that when I was prescribed almost forcibly, lovingly forcibly by my GP and my wife to take some sleeping tablets, had not slept for, 15, 20 days. It was a bad time in my life. But the reason why I was so scared was I had all these horror stories of sleeping tablets, addiction, you'll never sleep again. And it all starts to go round. And of course, I was so ridiculously tired, and the GP was with my wife saying, you need to take these. But I was terrified because I just thought, I don't want to be addicted to this drug. I've taken an opioid painkiller for a very short time. And again, I was so scared of ever consuming this thing that I needed for my back that I don't want to. But that's not necessarily a bad fear. Maybe I went a bit too far. I'm not likely to ever get addicted to drugs because I'm terrified of the things.
Sure. And there is an addictive personality. There's no doubt about that. Other people are on drugs for a long time for good reasons, opiates for awful long-standing pain. But it's the saddest thing is when people take something like oxycodone for a short time, for a short-lived condition. I don't know, say sciatica or bad back, and then once the condition goes, carry on taking it because they like it. And that's the big mistake, So if people only take painkillers for a short-lived condition, pain, then they're very unlikely to get addicted, because it's literally just dealing with the issue. It's when you then carry on once the condition disappears, and that's the mistake, and that's the addictive personality, and then all the horror stories take place.
I feel for folk like that. It's not likely to be me, because I just hate anything that I take that makes me feel different. I'm on beta blockers probably for life. I hate them because I know I feel weird, and I don't like that. I prefer the heart thing with them than without, but also I don't like the idea of anything. I hate paracetamol because it's doing stuff. I know it's doing stuff. Actually, when my oldest son went in for a hernia operation quite a while ago, there was a chap on the ward who was very clear, and I had you can't not hear the conversations in a British hospital. Curtains, they're not sound stoppers, are they? Anyway, he did not want to have any drugs whatsoever. And they said, look, you're in lots of pain. We want to help you. Can we give you some paracetamol, all this and that? So I don't want any drugs. My body is not having drugs. So they had to try and help him and work with him. And I don't know what they did because he weren't there for long enough. But he was absolutely like, I am not taking any chemically created drugs. I will fight this or I will die, but I'm not going to keep living just because I'm on drugs. And he had such an aversion to them, which I've never personally seen before.
No, it is interesting, and we've had patients over the years where you have to say, look, this is not forever; it's for a short time, but really, you'd be doing yourself a massive favour because I understand that. But if you're not careful, the the trouble, the pain that you're in, it's simply not worth it. Yes, you might think drugs aren't perfect. Well, fair enough, but pain is a lot less perfect. So, in that situation, you're just literally cutting off your nose to spite your face. Be kind to yourself.
So I do remember the bad back I had. I was told by the GP, apart from other things, to walk, which I tried to do. But he said the only way we're going to fix this is with the painkiller, because until you have removed the pain as an obstacle and you can force your muscle to work where it wouldn't work without the painkiller, you are never going to recover. Now, that took at least 6 weeks just to be able to sit up properly. But the painkillers did their job. I followed the advice, walked when I could, and all the rest of it. But I know now that sometimes there's a muscle pain that you need to push through. You need painkillers because your body's screaming at you. You can overcome it to a point.
God gives us wisdom, and sadly, humans can misbehave. But for most of us, there are times when we need painkillers. I remember when I'd had one or two of my various abdo operations, and I was desperate for pethidine, which is what the drug they used there in those days, IV. When I was due it, I was absolutely desperate because I was in awful pain. And literally, as soon as it went into my IV line, whew, instant relief. And it's for 4 or 5 days. Then you can go on the oral stuff and then taper off. That's fine. It's a short-term thing, and God gives us the ability to use these things, and He gives us painkillers, either natural or synthetic, that can really help us. It seems a bit perverse to say I'm never going to do this when actually just be kind to yourself.
I think that's a really important part of the message there, be kind to yourself, because I don't know what happened to that guy. As I say, I don't know whether he gave in. I seriously doubt it. But he was adamant. And I think, God's given us intelligence. He's given us doctors and medicine. And I think we do need to be saying, look, prayer works. Prayer's great. But you know what? It's okay to pray and take paracetamol. It's okay to pray and have a cast for your broken leg. It's fine. And I think maybe sometimes Christians get a bit guilty of trying to rely on God, where perhaps God's saying, well, yeah, I am here, but there's a doctor there, and he actually is there to help you. She's going to help you, and it's okay.
I mean, my view is, and God's undoubtedly supernaturally heals. There's no doubt. And until then, take the medicine.
Yes, I would concur completely. I have been healed once phenomenally. Have I said this before? I had a really bad throat. It was so bad when I got to A&E, the doctor said, I need to get your painkillers now before you feel what it's about to do. And he was scrabbling for painkillers. And I'm there thinking, that's not good. I've never seen a doctor that desperate to get some painkillers into me. What's about to happen? And it was excruciating painful. Throat, and I got painkillers. And I remember asking, because there's a piece of the Bible in James, and it says, call the elders of the church, and they will pray for you, anoint your head with oil, they will pray for you in faith, and you will be healed. And I had, as it happened, I've shared this as a story, I'm going to share it again because I think it's important for somebody. We had some of the elders of the church who happened to be coming for a chat. I didn't know what they were coming for when I booked the meeting, nor did they. I just said, I just know you need to come. Well, that meeting happened to be when I came back from hospital, as it happens. Anyway, they went to anoint me with oil because I said, look, James, I read it out to them. I need you to pray in faith and oil and heal, because it's seriously bad. And they did, and the pain went.
There we are. Fantastic.
It's the first time I've had that. Well, it was. And the thing is, that can happen.
Yeah, absolutely, it can happen. No, yeah, we are a faith. We are men of faith. This is a show of faith. But there's also the wisdom which says God's given us these things. Let's use them. He's given us the ability to make bricks for our houses. So let's make bricks for our houses.
Better than straw.
Use what he's given. And sometimes he decides to go over and above the natural laws. Fantastic. He's God. Praise God. Till then, use what's available.
Yes, which is why I'm still on my beta blockers, despite the side effects, which aren't very pleasant. But the other side effect that is a good side effect is my heart is less upset. So that's always a good thing. Dr. Richard Scott, thank you. I was just really interested in methadone, having had so many conversations in such a short space of time and realising, yes, I know what methadone is. No, I don't. And I need to I phoned my friend, Mr. Scott, the good doctor, sir. Thank you. What?
Thanks for the suggestion.
Well, it came to me, and I thought, well, I know who to ask, because I definitely don't need to be teaching on this, because that would not be good. Well, it'd be probably good fun for someone somewhere out there. If you've got any questions or topics you are curious about, you can send them to Dr. Richard Scott via myself. hello@pure247radio.org, hello@pure247radio.org, or you can read Richard in the magazines.
Thank you. Thanks for the plug.